We're not even 5 miles into this marathon, and people are exhausted.
As a leader of our state, how much enforcement should we really have with these kinds of issues?
Well, Antonia, I would say that Arizonans have taken physical distancing very seriously.
Arizona has become a new epicenter for COVID-19.
Maricopa County, where most Arizonans live, has by far the highest number of cases, deaths, and hospitalizations in the state.
Those of us in healthcare, we're very focused on helping others. We're not always very good at asking for what we need and the vulnerability that goes with that. Literally the 3 months since we've been watching the New York situation and watching that absolute devastation, trying to scramble to figure out how are we going to address it here. We're seeing presentations that we saw on the news in New York. We're seeing the level of hospitals being overrun.
The rate of infection is going up. It is spiking.
You still have your patients coming with heart attacks, broken arms, car crashes. How do you care for them? Emotionally and morally, that's injurious to us when we can't actually do that.
Moral injury is where one has to act in contrast to one's own values because of the setting that the action is happening in. The situation where a healthcare worker ordinarily would be able to say, we did everything that we could. And now they have to say things like, we did what we could given the resources we had under the constraints we were functioning with, and this is what happened. And that's a very different message to have to give to families and patients, and it causes a great deal of distress for the healthcare worker.
I knew there was a potential that I was exposed, and from that day forward, I never went home.
They're telling me that I'm clear to go back home on Monday, but I still have symptoms. And then I'm reading from other sources that, you can be a carrier of this for weeks. So I'm still not confident with going home and being around my mom.
We had a positive case. 3 of us nurses ended up being exposed to her before she was hospitalized. I really just didn't even think that she would pass away. And, it was really a shock for me to hear that. We lost a couple more people besides just her after I had already left and contracted it. While you're sick, to find out that the person that you contracted this from passed away, it's scary,
You can imagine at this time, this is a real problem for healthcare workers. At this moment when they are asked to do the most stressful aspect of their job, they also know that they can be bringing home virus to their family, to their immune-compromised family, to their children, to their community. And so thinking about how they can mitigate that led healthcare workers to do things like sleep in their car or sleep in a treehouse. And we wanted to come up with a better way.
HCW Hosted actually started from my partner and I nervously watching as the COVID-19 pandemic spread. And so we were thinking about how we could actually provide a mechanism for safe housing in Tucson, utilizing community-based resources, whether it be folks offering up the Airbnbs, which is where I'm staying now, whether it be hotels, whether it be dorms, and working with the university, trying to figure out how to provide those services.
So there are 2 other things that we provide. The second one is daily check-ins. So each day they receive a text message and they're able to fill out what physical health symptoms they're having, what kind of distress they're experiencing, and how their sleep is. And with those daily check-ins, if they exceed a certain threshold, we at HCW Hosted, our team members get in touch with them and find out what kind of symptoms are they having. And then from a psychological perspective, why is the distress so high today? Or what's getting in the way of you being able to get a good night's sleep? And to try and help them come up with ideas.
I honestly don't know if I would be able to emotionally handle being a nurse in an ICU unit and having people that you know are dying alone. Um, that's very hard to deal with on a daily basis, and I think a lot of people take that for granted. How long do they think that these nurses are going to be able to continue, to do this while putting their own families in danger?
Healthcare workers have a lot of coping strategies, and our job on the emotional wellness side is to reinforce those strategies they already know, that already work for them, and to encourage them to expand on those so they can go back in day after day to the same job.
Having a role in understanding the problem and creating a solution builds resilience within a community. It also builds community bonds, right? Which will make us as a community more resilient in the future for this big second wave that we're concerned about that'll be coupled with influenza. And that's just absolutely terrifying. Not just because of the numbers of beds and numbers of sick people, but we will have been at this marathon for a good 9 months at that point. Who's gonna have any gas left in the tank to charge up that hill if we're not actually minding about our wellness now? Healthcare workers are already twice as likely to commit suicide than the rest of the population. It's unacceptable for us not to anticipate the burden this is going to create on them and their family. And then what does that mean for our communities? Just like war scars a country and the population, the psyche of a population, we can try and minimize that. So that's what Hosted is seeking to do, and has done so in a very grassroots way, and trying to build up to be maybe less grassroots driven, but still community grassroots based, but bringing the institutions on board, whether it be the government institutions or whether it be the healthcare companies.
I think there are a few things we can do to support our healthcare workers. One is to recognize the enormity of their burden, but more importantly, offering resources in a variety of situations. So if you have an Airbnb and you would be willing to contribute it for some period of time at least, getting in touch with HCW Hosted so that we can list that as one of the options. Providing food, providing laundry services, providing other ways of helping these healthcare workers to deal with what they have to do.
The service that they're offering is amazing, and I'm personally very, very grateful to them. Because of them, my family didn't get sick, and I think that it could make a big difference for the community, not just the healthcare workers, but the patients too.